Health tech. Hasn't COVID-19 made that a buzzword? It started off with just online pharmacies, but now what you're seeing are platform plays. Whether it's the Tatas that want to do it via the acquisition of 1mg, whether it's Reliance Jio that wants to do it with NetMeds, or even PharmEasy, which acquired the old legacy ThyroCare for over $600 million. Our next guest is a startup which is also in the health tech space, going the digital way. You're talking about 90,000 doctors, 7,000 hospital partners. My next guest is Satish Kannan, the co-founder of Medibuddy, joining us today. Satish, welcome to ET Now and Startup Central. You know, you were earlier running a platform or for actually doctors, which you ended up merging with Medibuddy. But tell us, with health tech being such a buzzword, platform being such a buzzword, what is the differentiator when it comes to Medibuddy?
Hi, thank you for inviting us. It's a great pleasure to be on the show. So Medibuddy is a end-to-end digital healthcare platform. So like you know, India is a very, very large country, and the number of doctors that we have is very, very few. And all of these doctors, as well as best healthcare facilities, are also in the top cities. So what happens is access to good quality healthcare is always a big challenge in the country. That's a fundamental problem. Second is, when COVID happened, even if you are in the big city, you were not able to immediately travel or take your kids or your parents to a hospital due to the fear of COVID. Now, what has happened is, in such scenarios, one side, there is a lot of access related problems, and COVID has really created a lot of challenges for us to physically meet or physically travel. In such scenarios, accessing healthcare services in a digital way is actually of paramount importance. And that's exactly where Medibuddy is working. So Medibuddy is an end-to-end digital healthcare platform. So you can do a video call with a doctor. In case the places are very complicated, you can book an appointment, go visit them in the clinics or in the hospitals. You can book your medicine orders, and that medicine will get delivered at your house. You can also get your blood checkups done. So if you want to do a RT-PCR, or you want to do a diabetes test, you can book through Medibuddy, and somebody would come home. The phlebotomist will come home and pick up the blood samples. So in a way, you can actually do what we call as omni-channel access, online access through video call, or offline access where you book appointment and get the necessary medicines or labs, or even meet a doctor offline. So in a way, that is the key why we have been able to continuously grow, and that is Medibuddy.
And there's obviously forward integration at play as well, like you're pointing out that, you know, you have the doctors, but then you also provide the medicines and diagnostics as well with the results and all of that. But Satish, you know, I caught on to one phrase that you said, that we'll deliver the medicines to you. And you were also talking about the shortage of doctors, particularly in the non-metros. How are you going to do that? Are you already, you know, pretty much servicing a vast majority of the pin codes?
Definitely. Today, we actually provide healthcare services in more than 26,000 plus pin codes. And think like this. All the top doctors who are specialist doctors who work in top hospitals might be based in the big cities like Chennai, Bangalore, Bombay, Delhi, Hyderabad. And all of these doctors would be able to do a video call with patients across the country. If they're from the big cities, it's very easy and convenient for them. They don't have to travel. If they're from the smaller towns, it's very easy because you have a mobile phone with an internet. And just like you do a WhatsApp video calling with your family members, you can do a video calling through Medibuddy with a specialist doctor in around 22 departments. So all the way from general medicine, pediatrics, gynecology, till you get a second opinion from a cardiac surgeon or an oncosurgeon. So all of these specialties are available, and you can do it very, very easily. And with respect to pharmacies, what we have also done is we have got partnerships with multiple pharmacies across the country. So we have close to 2,500 pharmacies across the country who are on our platform. So based on the zip code or on the pin code, when an order comes, or if the doctor is actually providing a consultation, we can actually send the order to that pharmacy in that zip code, and that will help them to deliver it very easily locally. So that's why we are able to provide the right consultation on video call and also provide delivery of medicines across 26,000 plus pin codes today.
So Satish, COVID, for obvious reasons, would have digitized, would have accelerated a lot of your plans. People just got more comfortable with technology because of COVID-19. For health tech, there can be no fatigue, right, when it comes to all of this. But this is also a space which is now hotly contested, whether it is from Reliance, whether it is from the Tatas, or whether it's even the new startups like PharmEasy. Can I ask you, how are you going to stay as competitive?
Definitely. I think COVID is a really accelerator or catalyst in the way healthcare is getting digitized today. And it is true that as and when a new industry comes up, right? Let's talk about 10 years ago, e-commerce was really hot, or it actually started accelerating really, really fast. Then fintech plays came, and today it is maybe edtech and health tech is growing significantly fast. Now, from a competition perspective, at the very outset, first of all, we strongly believe that at Medibuddy, the reason why we have grown so fast and so big, today we help around 35,000 plus patients on a daily basis. And maybe 6-7 years ago, I started with a team of 2 people, and today we are around 1,200 people with offices in around 21 cities. So the key points are, one, we are actually the first mover in this market. So we have deep understanding about healthcare, and we have a lot of networks. So think about 90,000 doctors, 3,000 plus diagnostic centers, pharmacies, hospitals, and all of these are on our network. So very, very difficult for a new player to sort of build all of this in a short period of time. And at the very outset, the reason why I started Medibuddy was with the vision that we wanted to make high quality healthcare accessible to like 1 billion people. And as more and more players come into the market, it primarily helps in the overall benefit of the country, and it also creates more and more awareness. Now, from a competition perspective, we have always not so much worried about competition historically also, and then in going forward also. What we worry a lot about is, are we able to provide the right customer experience? When a patient comes on our platform and asks for a doctor or gets asked for a medicine or asked for a lab, are we able to provide the best experience, the fastest turnaround time at the right price for them, right? So that is our focus, and competition is not so much of a worry for us.
Are you going in for funding?
Yeah, so for now, we are very well capitalized. We had closed a Series B of close to 40 million. So company is very well capitalized now, and continuing to scale significantly now and in the coming quarters. But we'll definitely look at funding in the coming quarters after that.
Okay, so you are not worried about competition. You're saying you're well capitalized, and I think it's very, very safe to say that this cannot possibly be a one winner take all market. It has to be many winners take all market. Now, while you're attempting this platform play and going ahead with business, can you give us an idea of how consumers have responded?
Definitely. So I'll give you a couple of key points around how behaviors are also changed across, right? So key things that has happened during, let's say, COVID also is, one, we have customers or patients who have really adopted digital and online solutions to talk to doctors. So earlier there was some amount of, let's say, inhibition about, can I talk to a doctor online? But all of that actually got solved during COVID time. The second is also important to understand that a lot of doctors and a lot of hospitals have also adopted all of these digital tools very effectively. So just like you need to also have the, let's say if you're going to order something and the necessary vendor or the shop also should be online to accept online payments. Similarly, if customer is coming online, the doctors and the hospitals also have come online. So that has also happened. And then a lot of government regulations have improved significantly during this period of time, right? So that's one thing. Now, second thing that we've seen is there's been significant growth in the number of consultations that we provide across multiple departments. And departments that has grown very, very fast, which is actually a small division earlier, is example is mental health. So we all know that COVID was a very, very tough time for us as well as families, and it had created a lot of anxiety in people. So we saw that we have been able to significantly help people during these times. And so mental health has grown significantly. Of course, COVID and COVID-related consultations have grown. A lot of consultations for pediatrics. You're not able to take kids to the hospital, so pediatrics has grown very, very fast. And similarly for old people, so geriatrics and related ortho, diabetes related problems, and then mental health. So there has been significant growth in certain departments, which was initially not very, very big, but COVID has really accelerated the awareness as well as access to both of them. If you see also the number of medicine orders and home collections. So one key difference is earlier people would be okay to, if you want to do a blood work, if you want to do blood checkup for sugar or diabetes, you would be okay to, let's say, get up in the morning and travel to the lab. But today customers are happy as well as request that we send our phlebotomy team to their home. So all of these are clear examples that the significant movement as well as adoption of digital solutions like Medibuddy now.
And very quickly, Satish, we've seen the government also roll out the National Digital Health Mission, where it is expected that corporates, startups will be coming on board as APIs. Are you looking at that?
Definitely. So we call it NDHM. So NDHM is actually a great move, as well as a great work that is being done by our government in helping in digitizing both let's say the customer's journey, as well as in digitizing the doctors, the pharmacies, the hospitals, the diagnostic centers. And we are clued into it. We are in fact part of the policymaking team also, and we have given all our feedbacks as part of digital healthcare companies. And it's a great work that our government is doing. And that is going to really usher in great access to people across the country, and also create what we call as right transparency in the system, as well as provide visibility to data. So example is, today when we go to one hospital, you get a set of records. When you go to the next hospital, you have to carry these records like a big bag of reports, paper reports that you take to the next doctor. When all of this gets executed and also adopted by various parties, like the doctors, the hospitals, the pharmacies, a lot of these medical records will become digital, and test done at one hospital or one diagnostic center will be very easily available for another doctor in another hospital, and all of them in a digital manner. So all of these are great works that's being framed under the NDHM, and we look forward to it. And we are actually part of the team which is helping in framing these. And I think that's going to be great times, or at least exciting times for all of us in the coming maybe next 5 years.
And with that, Satish, thank you so much for giving us your time here on ET Now. Wish you all the very best.
Thank you. It was a pleasure talking to you.